Good afternoon, New Brunswick, and welcome to today's COVID-19 update for the province. I'm Vicki Hogarth at the CHCO News Desk. We'll be hearing from Dr. Russell and Minister of Education Dominic Carty very shortly. We should be starting any minute now. I'll just do a quick recap of the cases as we know them. There were 9 new cases of COVID-19 in the province yesterday. The breakdown goes like this. There were 2 in Zone 1, 5 in Zone 6, and 2 in Zone 7. Now, overall, there are 123 active cases in the province. That number will obviously change at the start of the conference when we hear from Dr. Russell with the new case count. Right now, as we know, there are 24 active cases in Zone 1, 20 in Zone 2, 22 in Zone 3, 26 in Zone 4, 2 in Zone 5, 24 in Zone 6, and 5 in Zone 7. Now, the numbers have been going down in a good direction lately, which is why the whole province is currently in the yellow level of recovery. Now, things that we should be expecting to hear about today. I do believe Minister Carty will be providing an update on 2 positive cases that were identified in the Lee Hayes High School in Fredericton. It does sound like we are going into the conference room right now, though, so be prepared to cut away momentarily. There is quite possibly an update on AstraZeneca and whether or not that will be put on pause. I know that's a decision they've made in Nova Scotia. Also, I don't know if any of you follow MP Wayne Long on Facebook. He did recently post earlier today that the vaccine rollout could be changing in terms of eligibility. I don't like to post it on our Facebook page, though, until it's made official by the province. So if that is something that we find out in today's conference, I'll post it right along for those who don't follow in the conference. And again, I'm following on Facebook as well. So if you're watching on Facebook right now, I do follow all the comments. So please write them there, and that could determine the questions we ask today. We are going to the conference room with Bruce right now.
Dr. Jennifer Russell et l'honorable Dominic Carty, ministre de l'Éducation et du Développement de la Petite Enfance. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dominic Carty, Minister of Education and Early Childhood Development. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. Le Nouveau-Brunswick a réalisé d'énormes progrès dans sa campagne de vaccination contre la COVID-19. La première dose du vaccin n'éliminera pas totalement la menace posée par ce virus, mais elle aide à réduire les risques de maladies graves, d'hospitalisation et de décès. Les citoyens du Nouveau-Brunswick ont répondu avec enthousiasme et à nos efforts de vaccination. Over the past week alone, 31,124 people in our province have booked an appointment to receive their first vaccine dose. And today we will pass 300,000 New Brunswickers who have been vaccinated at least once. That is tremendous news for our province. And I want to thank everyone who have stepped up to protect themselves, their families, and their communities. We've also been able to accelerate our campaign because our stock of vaccine supplies from the federal government has been growing steadily over the past several weeks. And we are on track to achieve our goal of providing a first dose to every New Brunswicker before Canada Day. We will today be making it possible for even more New Brunswickers to get their first vaccine dose, and Minister Carty will speak to this shortly. But I must continue to advise care and caution. COVID-19 is still with us, and those who are vaccinated must remain on guard against this disease. It generally takes about 2 weeks for the vaccine to take effect after your first dose, similarly to your second dose, and that maximum protection is after your second dose. And so, again, full protection does not happen until 2 to 3 weeks after receiving the second dose of a 2-dose vaccine. And until we reach that point by September, it will remain vital that everyone continues to follow public health guidance and advice. Again, to continue to achieve our goal, which has been our goal throughout the pandemic, to avoid our hospital care system from being overwhelmed. Tout le monde doit continuer à porter un masque en public et à respecter les consignes de distanciation physique. Tout le monde doit être à l'aguet des symptômes de la COVID-19. So, particularly with the new and more contagious variants that we're dealing with right now, the South African variant, the UK variant, and the India variant, the Brazil variant, these are all really important things to consider in terms of how contagious these are. So it is vital that anyone who suspects that they have COVID, they really, and even if you thought that you might be at one of the public exposure notification sites, you have to get tested immediately. This is how we're going to keep protecting our population. And currently in Fredericton, there are 16 locations where public exposures may have occurred. Although I just as I was walking in here, the update is actually now up to 24. And Horizon Health Network is going to be making an announcement as well about the Dr. Everett Chalmers Hospital. So there is a full list that will be posted on the government website. And as you know, in Fredericton, the cases that we have been dealing with are the India variant. Again, very contagious. That's what we saw at McGee House. That's what we saw at the Delta and some other places, including schools. If you are advised by public health to self-isolate due to a potential exposure, please do so immediately in a separate location from your family. If you are contacted, I ask that you treat our public health nurses and contact tracing staff with respect. You know, we're all human here. We've all been working at this for over a year, and we're all doing our best to protect the entire population and to protect our healthcare system. So also, the people that have been working at the borders tirelessly, the enforcement staff, they are also doing a tough job under extraordinary circumstances over an extended period of time. So their work has been critical to our success, and they also deserve your compassion, your kindness, and your respect. So under no circumstances should any of our staff be subjected to any kind of verbal abuse. If you have challenges, there are different ways to express that, but definitely not to our staff. For the last 4 days, all of New Brunswick has been at the yellow alert level in our provincial recovery plan. And we want every region to stay at this level, and we need everybody's help to be able to make that happen. Aujourd'hui, Santé publique confirme qu'il y a 16 nouveaux cas de COVID-19 au Nouveau-Brunswick. Un de ces cas a été déclaré à l'extérieur de la province. Il y a 2 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Une personne infectée est en contact d'un cas déjà confirmé, alors que l'autre cas fait toujours l'objet d'une enquête. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a un nouveau cas qui est lié à un voyage. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 10 nouveaux cas. De ce nombre, 6 sont des contacts de cas déjà confirmés, 1 est lié à un voyage et 3 font toujours l'objet d'une enquête. Un certain nombre de ces cas, de ces infections ont des répercussions sur les milieux scolaires à Fredericton. Le ministre Cardy discutera de cette question sous peu. Dans la zone 4, soit la région d'Edmundston et de Grand-Sault, il y a un nouveau cas lié à un voyage. Dans la zone 6, soit la région de Bathurst et la péninsule acadienne, il y a 2 nouveaux cas. Un de ces cas est un contact d'un cas déjà confirmé et l'autre cas est lié à un voyage et est à l'extérieur de la province. À l'heure actuelle, 10 citoyens du Nouveau-Brunswick sont présentement hospitalisés après avoir contracté la COVID-19, dont 3 sont aux soins intensifs. 4 de ces personnes sont hospitalisées dans d'autres provinces. Today, Public Health has confirmed 16 new cases of COVID-19. One of these occurred outside the province and is listed separately from the cases confirmed within New Brunswick. In Zone 1, which is the Moncton and Southeast New Brunswick area, there are 2 new cases. One is a contact of a previous case and the other is under investigation. In Zone 2, which is the St. John, Kings, and Charlotte counties, there is 1 new case related to travel. In Zone 3, which is Fredericton and the St. John River Valley, there are 10 new cases. And of these, 6 are contacts of existing cases, 1 is travel-related, and 3 are under investigation. And a number of these infections have impacted school communities here in Fredericton, and Minister Cardy will speak to this shortly. In Zone 4, which is the Edmundston-Grand Falls region, there is 1 new case related to travel. In Zone 6, which is Bathurst and the Acadian Peninsula, there are 2 new cases. There are currently 10 New Brunswickers in hospital, including 3 individuals in ICU. 4 of these cases are hospitalized in other provinces. And I ask again that you keep these individuals wherever they may be in your thoughts and your prayers. The vaccines being used at clinics and pharmacies right now are the Moderna vaccine and the Pfizer-BioNTech vaccine. Both of these are mRNA vaccines that work in the same way, and they have similar levels of effectiveness. The original data was around 94% to 96% efficacy after 2 doses, 2 to 3 weeks after the second dose, and also that is against hospitalization, ICU admission, and severe outcomes such as death. So, dans le cadre de notre campagne d'immunisation, nous continuerons à administrer le vaccin d'AstraZeneca dans les circonstances appropriées. Les risques associés à ce vaccin sont réels. So similar to provinces across Canada, our campaign will also continue to use AstraZeneca vaccine for second doses as per Health Canada's recommendation. So we will not be using the vaccine for first doses in our campaign for the general population, but there are circumstances where this approved and widely used globally vaccine can be used for homebound extramural patients who have provided their consent after fully understanding associated risks. So New Brunswick has seen 2 cases, including 1 death associated with vaccine-induced immune thrombotic thrombocytopenia, VITT. That's just a big, long, fancy word that just means that it's a vaccine-induced immune response that causes blood clots and low platelets. It is a very rare side effect of the AstraZeneca vaccine, and we have now confirmed 2 further cases of VITT in the province. And these are the cases which had been suspected and under investigation, and both of these individuals are in their 50s. They received a dose of the AstraZeneca vaccine in mid-April, with symptoms appearing about 11 days later for one individual and 19 days later for the other. And the average reported globally has been between 5 and 21 days after the vaccine. One has recovered and the other is in hospital undergoing treatment for this condition. And the risk of this happening after a second dose is reported as being around 1 in 1 million. Selon les données recueillies partout dans le monde, cette condition se produit dans un cas par 100 000. Il y a des rapports aussi que ça peut aussi être environ 50 000 à 250 000 doses. Le taux est un peu plus élevé ici, mais cela peut se produire. Je continue cependant à croire que nous devons continuer à utiliser cet outil pour prévenir la propagation de la COVID-19. Comme les autres provinces, et selon Santé Canada. And there is actually, at this current time, a PT meeting that's going on with all the chief medical officers of health across the country to discuss AstraZeneca and its use. And I will provide any of the pertinent updates that I receive from, as a result of that meeting when I receive them. The federal government yesterday informed us that New Brunswick has been allotted 13,500 doses of AstraZeneca vaccines from its latest shipment, which are scheduled to arrive during the week of May the 17th. And these doses will be used for second doses, as I mentioned, to help and also to help in the event of an outbreak requiring vaccination unless pending data suggests otherwise. And again, there is a meeting taking place today around this as well. Comme ce vaccin n'exige pas un entreposage à des températures extrêmement froides comme les vaccins ARNM. Nous nous en servirons également pour vacciner les citoyens du Nouveau-Brunswick âgés de plus de 55 ans qui sont confinés à domicile et qui ne peuvent pas avoir accès à d'autres cliniques d'immunisation. Ces patients sont vaccinés avec leur consentement après la communication d'informations sur les risques et les avantages du vaccin. Vaccination for these patients is being provided with their consent based on information regarding the vaccine's risks and benefits. And our approach may differ from what is used in other provinces, but in a general sense, we're pretty much in alignment. There are very small differences between each province, but again, that may change after the meeting that's taking place today. So in our judgment, we really must employ every tool at our disposal to limit the spread of COVID-19 and further outbreaks. This vaccine has been approved by Health Canada and has been used widely around the world with great effect. The United Kingdom has employed this vaccine almost exclusively, and they have seen significant reductions in severe illness, hospitalizations, and deaths due to COVID-19. There are risks with this product, but there are also benefits when it is used appropriately. We will assess those risks and benefits in how we employ this vaccine. And I have heard from physicians in the province as well when we did a presentation recently for the New Brunswick Medical Society. So we were able to address those concerns around our continued use of AstraZeneca as second dose. Je demande aux personnes qui ont reçu le vaccin d'AstraZeneca comme première dose de continuer à faire preuve de patience. En nous fondant sur les preuves médicales et la plus récente information, nous déterminerons comment procéder avec la deuxième dose quand viendra le temps de l'administrer. And while we are seeing great progress, this remains a confusing and stressful time for New Brunswickers. And right now there is research going into having the second dose of AstraZeneca be replaced with an mRNA vaccine like Moderna or Pfizer. That information was supposed to be ready for us tomorrow, but it's now being delayed until the end of the month. So we'll have more information on that as well. So our journey in this pandemic is not over. And even if the road ahead is beginning to look much clearer, people are tired and worried and upset, and tempers may be short. So just remember, though, throughout this time, again, I think it gets harder and harder as we see a light at the end of the tunnel, and we see that we're making such great progress with our vaccination program. I do ask everyone to look after yourselves and your families, and I ask everyone to remember to be kind. Show compassion and empathy to your neighbors. You never know what other people are going through. And this is Mental Health Week, and it's an appropriate time to remember the impact that the pandemic has had on us and how we can best equip ourselves and others for the next stage of our journey. Offer encouragement and support for those who may be struggling. A kind word will go a very, very long way to help people understand the importance of continuing to work together. I do have colleagues and friends who have family in India right now, and I have been in touch with them, and it is a very difficult time with what's happening in India. So if you know people that are struggling as a result of that situation, reach out to them as well. Our public health nurses need your support. Our enforcement staff at our borders need your support. I really need everybody to pull together now. Now it's more important than ever. So if you need assistance, if you need to reach out for help, I ask you to go through our provincial and national programs. I know that we have many families in our province with loved ones who are isolating in another province after being infected. And if you know somebody in this situation, reach out to them. Your kindness will make a difference in their day. J'espère que nous trouverons tous le moyen de faire preuve de compassion et de soutien envers les autres. Nous en avons tous besoin à l'heure actuelle, plus que jamais. Et ça inclut les gens qui ont des familles présentement en Inde, des gens qui ont des membres de leur famille qui sont dans les hôpitaux ici au Brunswick et aussi à l'extérieur du province, et aussi nos travailleurs de le département de sécurité publique qui travaillent à nos frontières. Je sais que tout le monde est fatigué, mais c'est le temps maintenant de vraiment avoir de compassion et donner notre support et notre appui à les autres. Nous pouvons réussir à traverser cette épreuve. Maintenant, plus que jamais, nous devons toutefois nous appuyer les uns les autres pour y arriver. Thank you very much.
Good afternoon, everyone. Bon après-midi et bienvenue. So as Dr. Russell said, we're continuing to move through this battle with COVID-19, and today is one of those days where there's both good news and difficult news. So starting with the difficult news. Last night we learned about cases impacting 3 schools in Zone 3 in the Fredericton area. So 2 positive cases were confirmed at Leo Hayes High School. So the school is closed for today for an operational day. And students will learn from home tomorrow as contact tracing is carried out. So that's going to affect around 1,500 students, around 100 staff. A positive case was confirmed at Nashwauk Sis Middle School, and the school is closed today for contact tracing. We anticipate at this point that students will return to school tomorrow, but school staff will reach out to families directly today with any new information, and that has impacted about 600 students and about 40 staff. And finally, we have a possible exposure to a positive case of COVID-19 at New Maryland Elementary School. That school is open today, which is our standard practice, but as always, if public health has anything that they need to talk to you about, they will be in touch. So no news remains good news. Because throughout the whole year, we've done our very best to try and keep our schools as safe as possible, to mitigate the impacts of COVID-19 on our public schools and childcare facilities, and within the limits of the Personal Health Information, Privacy and Access Act, trying to provide as much information as we are able to make sure that folks are informed about the situation with the disease. S'il y a un cas positif ou une exposition possible est confirmée dans une école ou une garderie, les familles et la communauté scolaire en seront directement informées. Sinon, car, comme toujours, la bonne nouvelle est aucune nouvelle. Si les familles rencontrent des difficultés pour se connecter à l'apprentissage à distance, nous disposons d'un centre d'appel pour vous aider en composant le 1-833-453-1140. Le personnel est prêt à répondre à vos questions sur Office 365, Teams, Wi-Fi, etc. Over the past year, school, district, department, and public health staff have gone above and beyond to keep our schools healthy, safe, and open, always doing our very best to minimize the impacts on learning to the greatest extent possible in the context of a global pandemic. So I want to thank everyone for their tireless efforts to protect our students and our staff. Because of you, New Brunswickers who may have no direct connection with the school system, our students have been able to maintain routines and ensure that their physical and mental and social needs are met. And in part, because of the incredible work of New Brunswickers, today I'm really pleased to be able to confirm that, thanks to the excellent progress we've had in rolling out our vaccine plan, we are able to open up eligibility to another age group. As of today, people who are 30 years of age and older will be able to book their vaccine. Appointments are going to be available to people in this age group from later on this afternoon, once the online booking tool is up and running and updated. And les rendez-vous peuvent être pris en appelant une pharmacie participante ou par une clinique fournie par les réseaux de santé Horizon ou Vitalité. So anyone who is eligible, you can go online and book your appointment there at www.gnb.ca/book-a-vaccine, all one word. And if you can't get online, if you have a problem connecting or don't have an internet connection, you can call 1-833-437-1424. Comme je viens de mentionner, nous faisons de grands progrès dans l'administration des vaccins. Et actuellement, 300 000 Néo-Brunswickois ont reçu au moins une dose. Cela représente plus de 42% des résidents âgés de 12 ans et plus. So the last 7 days alone, and again a shout out to my cohort, the Gen Xers, more than 31,000 people have booked an appointment to receive their vaccine at a regional health authority clinic. So to put that in context, that's about 1/5 of all of the appointments booked since March 18th, and it doesn't include the appointments that have been booked through the pharmacies. Nous nous portons si bien, mais nous devons continuer ce bon travail si nous voulons voir un retour à la normale avec plus d'ouverture en toute sécurité cet été. Ce n'est pas le moment d'hésiter. Si vous êtes éligible, faites votre part et prenez rendez-vous pour vous faire vacciner aujourd'hui. Nous avons toutes et tous un rôle à jouer pour mettre fin à la pandémie. Because we are doing so well, but we've got to keep up that good work if we want to see a return to near normalcy with more things opening up safely this summer. So it's not the time to be hesitant. If you're eligible, do your part to protect your fellow New Brunswickers and yourself from COVID-19. Book an appointment to get your vaccine today. We've all got a role to play in getting this pandemic to an end as quickly as we can wrestle it to the ground. And we see today from the cases in Fredericton that we're not through this yet. We can contribute by making the responsible decision to get vaccinated. And it was around This time last year, when I was in this room talking about our plans for reopening early learning and childcare facilities, as the province was slowly beginning the process of opening back up in the context of COVID. And it's been an incredibly difficult year for everyone. And I want to take a moment to acknowledge how far we've come in that time. En coopérant, en suivant les règles de la santé publique et surtout en prenant soin les uns des autres, nous avons fait des progrès remarquables. Nous sommes presque arrivés à la fin. Même si je sais que nous sommes fatigués, il reste encore un peu de chemin à parcourir. Lavez vos mains, restez chez vous lorsque vous êtes malade, portez vos masques, gardez vos distances, mais surtout, faites-vous vacciner dès que vous le pouvez. If we cooperate together, work together, follow those public health rules, care for each other, and most importantly, again, get vaccinated, we're going to be able to continue the incredible progress we've seen just over the last few weeks. We are almost at the end of this. And I know that everyone is feeling tired, but please continue to follow the rules from public health. Stay home if you're sick, wash your hands, maintain that social distance, and get vaccinated. We couldn't have imagined that we were even going to have vaccines this time last year. And now we have a range in front of us, safe and approved, and ready to get us out of this pandemic and back to a more normal life. So I'm asking everyone to go out and get your shot, not for yourselves, not just for the folks around you, but for everyone in this province. The old and the sick and the vulnerable, the people who need your protection. So please step up for New Brunswick and get your shot as soon as you can. And very soon, that's going to mean everyone in New Brunswick. So let's get this done, let's get this finished, and let's get life back to normal. Merci. Thank you.
Merci beaucoup, Ms. Cardy. Dr. Russell, thank you, Doctor and Minister Cardy. We'll now proceed with questions from members of the media. Each reporter will have one question and a very quick follow-up. You have the right to pose your question in the official language of your choice. Please make sure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très, très rapide. Voulez-vous rassurer de désactiver le son de vos micros? Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour. Peut-être que vous l'avez mentionné tantôt, mais je voulais savoir, est-ce que vous pensez qu'il sera encore possible d'ouvrir le vaccin à toute la population d'ici la fin mai, ou est-ce que ce sera plus tôt que ça ou plus tard? Je voudrais vous entendre là-dessus. Dr. Russell.
Oui, alors à ce moment-ci, on vient juste d'annoncer qu'on va l'ouvrir pour ceux qui sont âgés de 30 ans et plus. Et on avait déjà ouvert pour les gens qui étaient 12 ans et plus avec deux conditions médicales chroniques. Ça se peut qu'on peut faire plus d'annonces la semaine prochaine au niveau de qu'est-ce qu'on va faire avec les autres âges, mais encore, j'espère, on va faire des annonces la semaine prochaine pour les autres groupes.
M. Boudreau, as-tu un suivi cet après-midi?
Oui, juste pour confirmer que j'ai bien entendu quelque chose tantôt, vous allez continuer à utiliser le vaccin d'AstraZeneca pour les premières doses chez les personnes qui sont confinées et qui ont 55 ans et plus. C'est bien ça?
C'est ça, avec l'information qui va être requise pour avoir l'information au niveau des risques et pour le consentement.
Merci, M. Boudreau. Marie-Ève Brassard, Radio-Canada.
Oui, bonjour. Ma première question serait pour le ministre Cardy. En fait, je me demandais quand sera le temps de vacciner les jeunes de 12 à 15 ans, vous pensez utiliser la structure scolaire pour la vaccination, c'est-à-dire de vacciner dans les écoles, et est-ce que vous avez une date en tête?
Merci pour la question. On travaille en coopération avec Santé publique pour développer les plans pour assurer qu'on peut offrir les vaccins aux jeunes dans le système scolaire. Et absolument, on va essayer de le faire pendant cette année scolaire ou aussi rapidement que possible. C'est une grande tâche logistique, mais c'est absolument central le travail du système d'éducation et le gouvernement en grand. Santé publique, clairement aussi. Alors, c'est quelque chose qu'on va cibler nos efforts dans les semaines qui arrivent. On a déjà les plans en place pour... on a besoin seulement de les préciser maintenant.
Mademoiselle Brassard, as-tu un suivi cet après-midi?
Non, merci.
Parfait. Tim Roselle, Global TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, is there any concern at all about doses of the AstraZeneca vaccine expiring before they are used as a second shot for those who are eligible for that?
Not that I'm aware of, but again, we haven't really wasted very much vaccine, if any at all. I think we can probably count on one hand how many doses were wasted, but I don't think that's a concern at this moment.
Mr. Roselle, do you have a follow-up?
No, thank you, Bruce.
Thank you, sir. Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Dr. Russell, if a New Brunswicker who received a first dose of AstraZeneca and is approaching their second dose appointment very soon, can they choose a second dose from a different manufacturer, even though the research on mix and matching vaccines isn't complete yet?
Great question, Vicky. We were supposed to have information on that tomorrow, but we are delaying until the end of the month, the decision around interchangeability. But again, we've been talking about this at the national level, and we're presuming that we'll be able to do that. But again, I don't have the final answer today.
Ms. Hogarth, do you have a follow-up?
Yes, I'm just wondering if the risk of blood clots with the second dose is significantly less than with the first.
The reports that we have right now, Vicky, are that it's 1 in 1 million doses. For the second dose.
Thank you, Ms. Hogarth. Thank you, Dr. Adam Harris, Brunswick News.
Thank you, Bruce. Just following up on Vicky's question there, should New Brunswickers wait for advice on mixing, or is your advice to get the second AstraZeneca shot as soon as you're offered it?
That is a personal choice. We're offering it as second doses right now for people 55 plus who have received the first dose of AstraZeneca. However, over the course of the next 2 weeks, we will have the information about whether we could provide an mRNA vaccine or AstraZeneca for that second dose.
Mr. Harris, follow-up?
Yes, please. Question for Dominic Cardy. Minister Cardy, do you support using AstraZeneca only for second doses? Only for second doses? That's very different from what you said a week ago and ignoring NACI.
I strongly support the use of approved vaccines by our federal regulator who decides which vaccines are safe, and I do not change my comments from last week.
Thank you, gentlemen. Lauren Bird, CBC.
Thanks, Bruce. This is a question for Minister Cardy. In March, it was announced that middle and elementary school teachers would be getting vaccine clinics like the high school teachers did. Can you walk me through why that didn't happen?
I'll defer that question over to Dr. Russell.
Well, moving target. The time when we first made announcements and decisions around who was going to get vaccinated when really was at the same time that we were receiving more information from NACI around the different age populations that would be continued to be eligible for those second doses. So now, as of right now, we have the supplies we need to open up the age cohorts. As we mentioned, we're down to 30 plus right now. So any of those people in that age group can sign up for a vaccine now.
Ms. Bird, do you have a follow-up?
Yeah, this is for Minister Cardy. Should vaccines be mandatory for staff in schools?
Thanks for the question. I mean, at this point, no, I don't think there's any effort to try and make the COVID vaccine mandatory. Certainly, again, strongly encourage it. We're seeing around the world. You look at the UK, which a couple of months ago was in full lockdown and had been for months and months, with deaths racking up in the thousands. And with a national rollout of largely of AstraZeneca, their cases have dropped now to the point that they hardly have any deaths at all, and the infection rate is undergoing exponential decay, the happy opposite of exponential growth in cases. So my strong recommendation to anyone as a citizen of the province who cares about themselves and their own health, if you don't care about that, about your families and your community more generally, is get the shot, do the right thing. Shouldn't have to be something that's legislated.
Thank you, folks. Clara Pasica, Times and Transcript.
Thanks, Bruce. My question is for Dr. Russell. Good afternoon, doctor. So on Monday, you had expressed some specific concerns about the vulnerability of Zone 1, the Moncton region. I believe you'd spoken about chains of transmission that weren't linked to an origin case, as well as something about a case being tied to the Nova Scotia outbreak. So here in Zone 1, we'd like to know, are these have these links now been drawn? Can you tell us a little bit more about if you're still considering Moncton particularly vulnerable and why a little bit more specifically right now?
Well, as of right now, I'm worried about zones 1 and 3. In zone 1, it is the UK variant that is circulating. In zone 3, it's the India variant. In zone 1, the risks will remain high as long as the proximity of Nova Scotia in terms of their high case numbers remain. Those unlinked chains we didn't find a link to travel yet. The only good news really leading up till today has been the fact that we have really good testing numbers in Moncton, and I'd love to see them stay up as high as we can keep them. So anybody who has even mild symptoms, if they could get tested, then again, that gives us that confidence that we're not missing people. Although I know with the situation with the RCMP today, it did impact one of our testing centers. So that it will be a problem for today, but hopefully we can get those numbers back up tomorrow. For zone 3, again, we've got ongoing investigations and contact tracing, extensive contact tracing happening today. As Minister Carty mentioned, there's several schools involved. The hospital here, the Dr. Everett Chalmers Hospital, is affected right now. So a lot of contact tracing happening there. And my understanding is it's closed for visitors right now, and there'll be more information on that they're going to be making public. So yeah, my concerns around those two zones are quite high. And so the more testing that we can see happen, people not taking any small amount of symptoms for granted and getting tested. And especially if you've been to any of the public exposure areas as well.
Thank you, Doctor. Clara, do you have a follow-up?
Yes. Do you know how many cases in Zone 1 are currently not linked to an origin case right now?
Well, we had 3 different workplace settings that were impacted, and again, the continued ongoing transmission from those particular cases is being stopped by self-isolation, et cetera. However, the fact that we don't know where those index cases got COVID from, that's what remains problematic.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, I understand the Delta Fredericton is no longer one of the isolation hotels. I asked the Red Cross about that. They directed me to talk to you about that. So what can you tell us?
Yeah, that is correct. We now, I believe, only have 3 hotels that are isolation hotels now. The Delta does have 2 linked cases at the moment. Again, we did change our approach with respect to isolation hotels so that there are 3 in the province now.
Ms. McKinnon, do you have a follow-up?
I'm sorry, I didn't quite hear what you said as to why the Delta is no longer one of the isolation hotels. Could you please repeat that?
So when we started with hotel self-isolation, there were a larger number that were involved. JPS has been working really diligently with the Red Cross actually to make sure that all of the things that need to be in place for these to remain effective from an IPC control perspective and from a security perspective, that is those are the things that were prioritized in terms of moving forward. So we can be confident that, that they are effective in terms of providing a safe space to self-isolate. And again, at the Delta currently, we do have 2 linked cases there.
Ms. McKinnon, your follow-up?
So will there be another hotel to replace the Delta then, or are you saying that we don't need any more isolation hotels?
Public safety, again, I think there is another one here in Fredericton. It's not announced yet, though.
Thank you, Ms. McKinnon. Derek Montague, Huddle Today.
Hi, good afternoon. It went around on social media today that the New Brunswick government is looking to reopen the Atlantic bubble, hopefully by July 1st. Is that true? Is July 1st still the target date?
I think these targets are always moving targets based on our epidemiology. It's really unpredictable at this point to be able to say what will be possible. We have to wait and see what happens in Nova Scotia around their case numbers, and obviously we have an evolving situation here in Zone 3, so it's very difficult to predict.
Mr. Montague, do you have a follow-up?
Yes. Dr. Russell has been coming through a bit garbled. I don't know if there's a technical issue, but can she please repeat the answer?
Can you hear me now?
Yes, much clearer, thank you.
Okay. Has that been the case for the entire press conference?
It has been a bit garbled on my end, yes.
Okay. Well, so in terms of a date for having conversations about a bubble, it is really challenging with so many things that change so frequently. So if everything goes well, then certainly that would be an option. But at this point in time, we're very concerned about Nova Scotia and how things are progressing there, and we have an evolving situation here in Fredericton.
Yeah, and just to reinforce what Dr. Russell was saying around the July 1st date that the Premier offered, this again, it is a moving target, but we can all play a role in helping us to get there by following the rules that public health has laid out, that we continue to see these outbreaks popping up, and that's likely to continue even as our vaccination rates go up. But we have got everything to fight for at this point, that as much as there was stress last summer, we remember having a relatively open summer here in New Brunswick. We remember looking across the country and seeing others having to endure lockdowns that we couldn't even really imagine. And that situation is even more extreme today. You look around the country and there are huge parts of Canada where people cannot go out and live any sort of normal life. And so if we want to protect what we have here, we have to continue to endure these restrictions for the next few weeks. And then the hope on the other side is we have that Atlantic bubble, we have that possibility of broader travel, and then a full return to normal, which is what we're shooting for, so we can end these restrictions, get rid of our masks, and get back to normal. That's why we endure the restrictions that are in place, not because anyone wants or likes them, but because they're necessary to get to the other side of this.
Mr. Montague, do you have a follow-up?
No, thank you, Bruce.
Thanks, bud. Meg Cunningham, CHMA-FM.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, Zone 1 shares the border with Nova Scotia, which is in the middle of an ongoing outbreak, as you know. What sort of information does Nova Scotia share with the New Brunswick government in regards to the current outbreak?
Well, I have calls with all the Atlantic Province Chief Medical Officers of Health weekly. We also have national calls 3 times a week. If there are specifics around cases and contacts, our public health team is contacted by Nova Scotia's public health team. So there's quite a good flow of information between the 2 provinces.
Do you have a follow-up, Meg?
I do. Apologies if you said this earlier, but I couldn't quite hear you. Do we know how many cases in New Brunswick have been traced back to the ongoing outbreak in Nova Scotia?
Pardon me?
Do we know how many cases in New Brunswick have been traced back to the ongoing outbreak in Nova Scotia?
My understanding is the number is 2.
Thank you, Ms. Cunningham. Alex Villeneuve, Radio-Canada.
Bonjour, Mme Russell. Concernant les cas dans la zone de la péninsule acadienne qui comprend la région citateuse, donc la CIT, est-ce que vous pouvez nous dire combien de cas sont à l'extérieur de la province et combien sont réellement et physiquement dans la zone CIT?
Oui, je crois que quand que j'avais lu mes notes, c'était dans dans le discours. Je peux le trouver pour vous. J'ai lu toute cette information durant le commencement de la conférence de presse.
C'est bon? Oui, vous pouvez m'envoyer l'information. Pour aider les citoyens à y voir plus clair et les aider à mesurer l'état de la pandémie dans la région, est-ce que vous comptez séparer les cas annoncés physiquement dans une zone et ceux qui sont à l'extérieur de la province? Et sinon, pourquoi ne pas faire comme ça?
Monsieur Villeneuve, peux-tu approcher plus proche à votre micro? On a la misère d'attendre.
Oui, est-ce que c'est mieux comme ça?
Oui, mon chum, vas-y.
Oui, donc, comme je disais, c'est pour aider les citoyens à y voir plus clair et les aider à mesurer l'état de la pandémie dans une région. Est-ce que vous comptez séparer les cas annoncés, les cas physiques dans une zone et ceux qui sont à l'extérieur de la province? Et sinon, pourquoi?
Alors, au niveau national, il y a un tel processus pour annoncer les cas. À ce moment-ci, on va essayer de diviser les cas annoncés par l'endroit qui sont physiquement durant leur auto-isolement. Et c'est le processus tout alentour du pays. On a plusieurs qui sont en auto-isolement à ce moment-ci en Alberta.
Merci, Monsieur Villeneuve. Mia Urquhart, CBC.
Thanks, Bruce. My questions are for Dr. Russell. Because you're using AstraZeneca for second doses only, why wait to vaccinate this group? Why not offer the second dose according to the manufacturer's suggested timeline?
Great question. Our challenge for all of the vaccines up until now has been the volume of doses that we would receive, and so that is why we changed nationally, we changed the approach with respect to the interval between first and second doses to allow for the ability to have everybody get their first dose of vaccine on board as quickly as possible. So we don't get another shipment from AstraZeneca until, I believe, the end of next week. And again, we're still waiting to find out if we're going to be able to interchange the doses of AstraZeneca and mRNA. So whatever we have that people can get their second dose with, we can provide that. Again, we don't have a lot of doses on hand right now. I believe we were down to between 2,000 and 4,000. And again, we're only getting another shipment next week of about 13,000.
Ms. Urquhart, do you have a follow-up?
I do. I'm wondering if the province would consider loosening the travel restrictions for those who want to visit dying loved ones who don't qualify for an end-of-life visit. We've heard from a lot of people in this position, I'm sure you have too, and they say they can help with extramural care. As long as they follow the rules, why not let them come?
It's a great question, and throughout the pandemic, it has been challenging to make these decisions and to hold to them. It's even more difficult now because the pandemic has gone on for so long, but it's more risky now in terms of the variants. So the variants have taken over. There's very little wild-type COVID-19 circulating. And so all of those variants have the same properties in terms of increased transmission risks from 30 to 70%, increased severity of symptoms, and increased risk of hospitalization and death. So as much as people are finding it challenging right now to have these rules in place, we do need to maintain them until we get the majority of our population vaccinated with 2 doses of the vaccine. Because if we relax any restrictions or rules between now and then, we can have increased numbers of cases that would require hospitalization and ICU admission and could have a larger number of deaths.
Monsieur Villeneuve, est-ce que vous êtes branché encore? Madame Russell a une réponse concernant la zone 6.
Alors, juste pour répondre à la question que vous avez posée tout à l'heure, il y a 2 cas dans la zone 6, puis il y a 8 autres cas qui sont à l'extérieur de la zone 6. Je dis à l'extérieur du province.
That concludes today's COVID-19 update for New Brunswick with Dr. Russell and Minister Carty. Just for a quick recap of the numbers, there were 16 new cases of COVID-19 in the province today. The breakdown is 2 in Zone 1, 1 in Zone 2, 10 in Zone 3, 1 in Zone 4, and 2 in Zone 6. Now, I will be posting, for those of you who asked, the active case counts and those breakdowns on our Facebook page as soon as I have that information from Public Health. Other good news that we learned today is that the vaccine is now available for New Brunswickers who are 30 and over, so you can schedule your appointment starting right now if you are in that age group. Also, AstraZeneca has been put on pause in terms of being offered as a first dose for New Brunswickers. And if you have received that first dose, the second dose of that will be available to you. But as Dr. Russell did mention, and we asked, you are less likely to get blood clots from the second dose of AstraZeneca. The chances of that are about 1 in 1 million, which is significantly less than with the first dose. I look forward to joining you next time. I should have an update for you either by Monday, maybe tomorrow, who knows, on when the next conference will be. I look forward to joining you again. I'm Vicki Hogarth at the CHCO News Desk.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.